think first thing to say, which I found quite gratifying, is that I've spoken at a few conferences in the past, and very often the patient voice is somewhere late in the afternoon. The fact that I'm on relatively early this morning, I think, speaks volumes about the reason why, in a sense, why we're here. There's no point doing this, in a sense, unless the patient gets to know about the results. Need to set some context and establish my credibility here. I spent more than 20 years as an NHS manager and a short while with the Home Office in Whitehall, which was an interesting experience. And I worked out the other day that I'd spent more than 2 years as an inpatient on doing various surgeries. And those surgeries included pretty much 2 of everything: 2 renal transplants, a couple of hip replacements, upper GI surgery, eye tumours and cataracts. You can read the list there, including testicular surgery. I suppose 2 of everything is even more appropriate there. But I'm stood here and looking, I hope, very well. And that's testament to another thing that Bruce highlighted, which I think is important to reiterate, and that is that for the most part, the care within the NHS is excellent. So I'm here, after all that, looking reasonably well. I'm now using the experience that I gained both as an NHS manager for 20 years or so, but more particularly, I think, as a patient in doing some work for the Royal College of Physicians, Medicines Regulation Agency, and others, and finding that really interesting, and including being involved in this process. Okay, the patient. We're all potential patients, whether that's at a fairly superficial level, going with relatively straightforward ailments to our GPs. But the fact is that the majority of us will have surgery at some point in our lives. I couldn't find a figure for the UK, but I think in America, something like 75% of people at some point, probably later in their life, most people will have surgery. And in terms of what happens when the worst happens and you do need to face that time, we also need to consider that it includes what I described there as concerned families and carers. So that, we'll all have heard of examples where if somebody is unfortunate enough to develop a serious cancer or needing surgery for another intervention, very often the families of that individual will get involved trying to find out where the best hospital is for them to have their care, or at least to reassure themselves that the surgery is going to be okay. There's clearly a context where patients are concerned in terms of, as Bruce also said, the Mid-Staffs report, the Francis report following that. Again on the news this morning, CQC in the dock, as it were. Even our regulators now are being found wanting. And that's led to a situation where I think patients and the general public are losing faith to an extent in the quality of the NHS. They probably don't need to. The care out there is still very good. But the climate is one in which we're needing to catch up and regain some good reports. There's clearly also a choice agenda. I mean, the idea that patients now have choice in the care they receive in the NHS has been around for a few years now. And I'll come to that on the next slide and say a bit more about it. But patients are increasingly at the centre of what the NHS does. Francis has said as much, but even the previous immediate legislation that we're now working under describes the patient as being at the centre of, or should be at the centre of the NHS. And after all, they're the main beneficiary of an intervention. There are lots of people working within the NHS, and it's important that people feel fulfilled in what they're doing. But ultimately, it's the patient who's the one receiving the care or the intervention. Now, at the same time, I would argue that probably the majority of patients are still relatively uninformed when it comes to what's happening within the NHS, the fact that they have a choice even. And that obviously is going to change over time. It's starting to change. What does a patient want? Well, clearly they want to survive if it's a surgical intervention, first and foremost. As I've said, many of us will face surgery, but it probably will only be at one point in their lives. But it can be a really challenging situation at the time. And survival is it's a very Western thing, isn't it? Death, being afraid of death. And clearly something people want to do is to survive. But more than that, I think, for me, one of the most important aspects of all this is the reassurance that things are going to be okay. So, although it can be about quality, it is about quality, it's about coming out the other end with the reassurance that things are going to be okay. Bruce mentioned that when somebody goes into to meet with a team, they've got something wrong with them, they're needing to have an intervention, surgery or whatever, they tend to want to know who the surgeon is. Very often that's not the case, I have to say. So sometimes patients will go in for surgery, they may not know whether it's the consultant surgeon who's performing the procedure or whether it's a senior registrar or a member of the team or a trainee even. It's another important issue for me is knowing who the surgeon is, and that's about how the process works and the information that's given to the patient. Choice. Yes, patients do technically have a choice. At the moment, I'm not sure that patients know that they do have a choice. That situation, I'm guessing, will improve over time. But it's back to this thing about reassurance. If people are sufficiently reassured that their local hospital provides a decent service, they're probably not going to want to go elsewhere. Clearly, they're interested in good outcomes. And what we need not to forget, I think, is that follow-up is almost as important as the procedure itself. So, having hip replacement, what follows that, good physiotherapy and so on in terms of the extended multidisciplinary team. In terms of what the patient needs, with apologies to Tony Blair there, information. There's massive amounts of information out there. It's about making the information for patients accessible, understandable, and patient-friendly. Patient-friendly may sound slightly patronizing, but I suppose we have to work to the lowest common denominator. There will be some very experienced patients out there. But it's about communication. It's about communicating the information that's generated from this scheme into an understandable form. And if we, again, talking about Tim Berners-Lee, the internet, everybody Googles nowadays, more particularly if you have something that's seriously wrong with you. But it's about taking the information that comes from this process and contextualizing it and interpreting it in such a way for patients so that it's very understandable, preferably with a supporting narrative. And NHS Choices has already been mentioned. They have lots of experience now in turning information into a form that makes it more readily understandable for patients. And then as a patient, I really do believe that this initiative will drive up quality, both of the interventions themselves, surgery and other interventions, and also, importantly, for the information itself. Most people, I'm guessing, are surprised that this isn't already in place, as is the case with things like revalidation and surgical checklists. I'm guessing that a lot of patients out there will imagine that this sort of information is already available. The fact that it's not is unfortunate. And it's an evolving process. I think we ought not to expect that this will be, perfect the first time it hits the streets. It's a pioneering approach. I'm right in saying that we're the first country in the world to be doing this to any great extent. And the other thing I would say is don't underestimate the patient. Put yourself in their place. There are as many different patients out there as there are people in this room, and there are some very expert patients out there as well. And finally, just a reality check. As I said right at the beginning of this presentation, the overall standard of care is already high. So in a sense, there's not much to worry about. But we do need to make sure that the very few instances of poor care are brought into check and brought into the fold, as it were. Some centres are already using this sort of outcome data and have been for a while to improve quality and safety, and the challenge is to basically make sure that everybody is doing that. As I already said, patients only exercise choice if they're uncertain about something. If they're reassured about the quality of the care out there being good, then it's likely they will be happy to go to their local hospital. If they're not, then they do have the choice to go elsewhere. But in my experience, that tends not to happen if people are reassured that the local hospital does provide good service. Some won't know that they even have a choice, and that's, I think, a challenge for those of us who are involved in getting information out to patients themselves. But coming to the end of the presentation now, what I'd really like to say is that information in its many forms can be beneficial, provided that it's provided in the right sort of way. We've got a Google generation now. There are over 1 billion smartphones out there. I think I read the other day that something like 365 billion photographs are taken every year. Whether we like it or not, we're working in an information age. People are going to be expecting more information of the right sort and available to them in the right sort of way. Communicating the information for me is absolutely key. And one of the most important things there is timing. It's no earthly good to have had your hip replacement and then learn afterwards that either your surgeon was good or bad, or the prosthesis you had was in some way deficient. So clearly we need to make sure that the information that patients get is delivered to them in the right way and the right time. And I thought you were an adult enough audience for me to end on something of a light-hearted note in terms of illustrating that timing. I think that's probably a little bit too late for most people. And thank you for participating.